Good morning, Peter Goertz. I'm a psychiatrist. Is it unethical to be a psychiatrist? In my opinion, I don't think so, but certainly I don't always feel good about what I'm doing. It's important to look in the mirror for any of us, and we want to actually do that. It's not always pleasant, not always easy. And in psychiatry, various things can strike us if we're a psychiatrist as not great. I have, let's say, not enough time to see the patient, limited time. Sometimes I discharge a patient to the street. Do I feel good about that? No. In general, these, however, are not black or white issues. We want to have a balanced approach. You see a lot of different things that don't necessarily feel good when you hear about them or see them. Let's say a hospital may not accept a patient because the patient doesn't have insurance. So that would be, they wouldn't accept a patient for a psychiatric hospitalization because of lack of insurance. A hospital may not accept a patient because the patient is violent, which sounds kind of like a joke, because the reason the patient would need to be in a psychiatric hospital could be because they're violent, because they're dangerous to others. So things certainly at times don't feel good. Things that we see as psychiatrists, things that we experience in our work. We want to look at the other side. How do patients feel about the care they're getting? And it would be interesting to have a survey of a huge amount of patients, outpatients, inpatients, psychiatric patients, and see how they feel about their psychiatric care. In my experience, a good amount of patients feel grateful actually for their care, even patients who were locked up in a hospital and then discharged. And another aspect is family members. Family members may feel very grateful for the care psychiatrists are providing. Freedom is important, of course. Freedom in general. We want to maximize someone's freedom in life. On the other side of the coin, though, we want them to be free to seek psychiatric care, seek psychiatric hospitalization, and that can happen. You do see patients. I recently saw a patient who was psychotic, and he knew that it was time for him to go to a psychiatric hospital. He wasn't necessarily enthusiastic about it, but he said, yeah, I do need to go to a hospital, and that's really what he wanted. So we do in psychiatry at times take away someone's civil liberties by locking them up in a hospital against their will. But some people, on the other hand, like the gentleman I just mentioned, realize that they do need to be in a psychiatric hospital in order to get treatment. And things change. Patients' perspectives can change. Let's say someone was admitted after attempting suicide. They did not want to go to the hospital, but then they feel better, and after the hospitalization appreciate that. Even people who've been forced in a hospital to take psychiatric medicine down the road may appreciate that actually when they feel better and do well after discharge. And I've had the situation, a strange situation, in the hospital where I used to work on an inpatient ward. There was a court in the hospital itself, and we would go to court at times, sometimes every week, depending on the patients we had. And patients would request that the judge discharge them from the hospitalization, and we would request that they stay if we felt it was appropriate. Sometimes, if someone wanted to leave, we would just discharge them if we felt it was okay, if we felt they were not dangerous. So I would go to court pretty regularly in an adversarial position against my patients, and then before that I would be their doctor, after that I'd be their doctor, but in court I would be testifying against what they wanted. Now, even in those patients, not infrequently, after they were at the end of their hospitalization, they would appreciate the care and appreciate that I cared enough to go to court and make sure they got enough treatment to be doing well enough to be discharged. Not every patient felt like that, of course, but some patients definitely did feel like that. A question, of course, to ask is our society perfect? Of course not. So there may be, in general, alternatives to what we're doing in psychiatry, but our society is quite limited. I'm talking about the US society. And if someone's dangerous, we want to care as a society enough about them to try and make sure they get help, even if that includes hospitalization against their will. There may be, in other societies, options that feel less coercive and that work well. Let's say in a rural society where there's a lot of extended family, someone might do well without hospitalization, even in a psychotic episode. So we have some limits in our society, and that can change, of course, if our society changes. One thing not to forget, though, if we're feeling bad about ourselves as psychiatrists by thinking, oh, I'm being coercive a lot of the time, let's say if I work on an inpatient ward, a lot of patients, many psychiatric patients are in voluntary outpatient psychiatric treatment, and they appreciate their care. They come voluntarily for appointments. In fact, often they complain because they can't get appointments soon enough. So many patients are grateful for their care, grateful for the medications, even though, of course, the medicines can have side effects. And often patients who do have side effects, even significant side effects, want to continue their psychiatric medication because they feel better on it. So that's another balance that you want to strike with patients, that even if medicines are causing side effects, if the patient feels that the risks or the side effects, the benefits outweigh the side effects, the stress due to the side effects, you may want to continue the medicine and just monitor visit by visit and see how the patient feels down the road about the side effects and about how they feel psychiatrically in general, if they're doing well psychiatrically. So overall, it seems wise to try to do our best ethically, do what feels right ethically. And sometimes we may not feel good about what we're doing. We want to do the best we can. And humility, I think, also is important. We're not always going to do things in an optimal way. And again, we just want to try our best as psychiatrists. Thank you.